we're going to be doing the manual muscle test and then lengthening for the levator scapula. And I'm going to be lengthening his left scap in this video. So I'm going to go through a couple of the actions with you and move the scapula around a little bit. So here's the inferior angle, and I have the acromion over here, and deep to trapezius is the superior angle. So as levator scapula pulls the scapula up towards the neck, it's going to elevate the scapula and keep it in more of a downwardly rotated position. Versus if he was to use his trapezius, that acromion process would be coming closer to the ear. So as the person does this action, they want to elevate it up, good, straight like so. So we're going to call that elevation with downward rotation of the scapula and an ever so slight retraction, but that's not really heavily focused on this. So that's the action of the scapulothoracic joint. Now in the cervical spine, because it's attaching along the transverse processes here, the head is going to laterally flex towards the scapula. It's also going to ipsilaterally rotate, and then ultimately there's a slight bit of extension in the neck, not so much at the head. So if we put the two together, it's going to basically almost pinch the head and cheek to the side of the shoulder. So I'm going to ask that you can do that action on your own. Good. So that is going to be our active range of motion. The reason why we're doing active range of motion in the seated position is the muscle mainly works on the scapula, so we're trying to elevate that against gravity. Now I'm going to bring him partway into the action and partway into the action. This is a little bit tricky, but you're going to try your best to use whatever hand hold you feel most comfortable. So I'm going to place one hand down on his scapula near that acromion. I'm going to be placing my other hand to the side of his head near that temple. So with my shoulder hand, I'm going to be pushing down, and with my upper hand, I'm going to be trying to rotate him away. You're going to let me win just to showcase that a little bit good, and laterally flexing him away. Okay, so we're going to hold here. Please do not let me move you. And in this, I'm going to be pushing down harder on the scapula hand than I am on the head, because again, the primary action. So we've held that for 5 seconds. Excellent. I'm going to lengthen him out a little bit, and then he's going to go through that action himself. And if you need to, you can give them verbal or tactile cues to help them complete that action. So if you want a little bit more pressure out of the scapula, you might tap and say just a little bit more pressure from here instead of from the head. Let's try that one more time. Excellent. Okay, so that's the active, break, and concentric for levator. So the length now, what we're going to be doing is, again, we need to take the scapula and cervical spine away. So I'm going to start with the scapula, and we're going to push it down a little bit. So you're going to hold down on that acromion. I'm going to be tipping his neck forward, so we're getting cervical flexion here. Again, I'm not on top of his head, I'm towards the base of it. I'm going to laterally flex him away, and then using my fingers and my hand, I'm going to rotate him away. So oftentimes this is kind of like sniffing the armpit, is a cheesy way to kind of remember it, but you're basically bringing their head towards their axilla on the opposite side. Now I'm going to reverse my hands and show that again, because it can be done the opposite way. Again, hand on the side here, my opposite hand to the head, so I can gently tip him forward, laterally flex him, and then rotate away. And that will conclude the length test for levator, as well as that manual muscle test.